But what are the most effective evidence-based treatments available today for tinnitus that you use in your practice?
Great question. So there's 3 that I can talk about. One is called tinnitus retraining therapy. The second is called cognitive behavioral therapy. And the third is called bimodal stimulation. Tinnitus retraining therapy includes devices that are worn on the ears. I have some with me right here. So most commonly, these are hearing devices that when they're fit on, for those of us who are on video, I'll show you guys, when these devices are on the ears, they look similar to modern hearing aids, sleek with a piece up and behind the ear. And for tinnitus retraining therapy, someone would have those fit for what's called sound therapy. So imagine a soothing white noise that mixes in with the tinnitus sound. And an individual would wear those on their ears during daytime hours for a treatment period of most commonly between 6 and 12 months. Additionally, an audiologist like myself trained in this method would provide specific types of counseling and coaching on how to deal with sleep, how to deal with stress, anxiety related to the sound. So separately, there's an approach called cognitive behavioral therapy. And this is a more psychological approach where we know that the tinnitus can impact the limbic system, which is our emotional regulation, our fight or flight response. And if we can get that in a better place, then the brain can start to learn over time to reduce the sound. All of these treatments I'm talking about, the goal is to reduce the awareness and ideally the volume of the tinnitus sound over time. So that can change people's lives, and that's what they're all aiming to do. The third approach is bimodal stimulation. And currently there's a device that uses 2 forms of stimulation, one through the tongue and one through the headphones. And that particular device also aims to reduce the tinnitus sound over time. Based on the individual case and what someone is going through, along with the existing evidence that's available today, a tinnitus specialist like myself, an audiologist most commonly, potentially an ENT, ear, nose, and throat doctor, we would work with that patient and recommend a specific treatment that we think has a high likelihood of success.
In addition to cognitive decline, what other major health risks are associated with hearing loss and tinnitus?
With tinnitus, health risks are the quality of life, insomnia, anxiety. With hearing loss, awareness of your environment and safety, plus the brain health and communication.
Because I would think there'd be some association with metabolic conditions because, if we're not getting enough sleep and all that kind of stuff, our hormones get out of balance.
Absolutely. And I'd be curious of, your thoughts of if someone has tinnitus and they're they're more stressed and they're not sleeping. I mean, though what I've learned over the years from my own personal health, stress and sleep are the foundation of everything else. So what would happen for someone for any reason if they start to get worse sleep and they're stressed all the time?
I mean, again, I don't have the literature backing all of this up, but I would assume that, you would see cortisol certainly be out of balance because we're not getting that regular circadian rhythm with proper sleep. That can impact our weight, our insulin resistance, the risk of diabetes. I could just see that a whole host of conditions that we generally associate with high stress, with physical inactivity and all those types of things could also be associated with tinnitus.
Absolutely. Absolutely. I would definitely agree from a doctor in this field who's personally worked with hundreds of patients, and we have a team of 8 audiologists working exclusively with tinnitus. So we see, thousands of patients and fully agree with what you said. It can be a serious problem. And I think that's the approach we need to have, is recognizing this is not just one symptom, but this impacts the global health and brain health in a way that can be really surprising to people.
Again, that's why we have you here on this podcast today, is because we don't take an approach of being kind of more reactive medicine. We tend to be trying to be more proactive in terms of how we age well, and addressing these issues like the first sign of tinnitus or hearing loss and these other things need to be addressed early so that we can, prevent a lot of these other conditions from happening down the road. And so I love kind of what you're doing. we've talked a little bit about the sound therapies, and you've explained how they work. Who do these tend to help the most? Is there, as you're looking at this, what person do you think is going to most benefit from, say, cognitive behavioral therapy, or and I'm trying to remember the exact terminology used, from the earpieces that go in and then the bimodal stimulation?
Typically, I would recommend patients use fundamentals of the sound treatment at the beginning, as well as the cognitive treatment. In my opinion, those are the two fundamentals that patients can implement right away, and then you can get a more professional treatment for both of them. So for the sound treatment side of it, it would be, the devices like this that have specific sounds inside of them that are used for the treatment, or considering getting hearing aids that can also be used for the tinnitus treatment. The other pillar would be this cognitive treatment layer. And there are certain things you can do on your own. You can study the fundamentals of how to deal with anxiety or stress, or how to get better sleep. And then if you needed extra help, then a professional like myself could work with you on those domains, or you could work with a therapist or a psychologist, right? So I'd say those are the pillars, and that's where most of the benefit today is available for patients. Depending on how those go, a specialist like myself may introduce other approaches, including bimodal stimulation, including other medical referrals to evaluate the jaw, TMJ from a dentist, or the neck, upper neck conditions from a neck specialist. Sometimes medications can cause tinnitus. Sometimes other medical conditions like cancer treatment, or certain inner ear conditions can also cause it. So hopefully that's a helpful framework of how people can get started quickly and then escalate depending on how things are going or how quickly they want to progress.
So it really underscores this need to be having our hearing regularly tested.